This video demonstrates the skill of securing a standing patient to a longboard using only 2 providers. This procedure is ideally completed with 3 or more providers, but in some situations there may only be 2 providers available. The first provider initiates manual inline stabilization of the patient's head and neck from behind the patient with their forearms resting on the patient's back for additional stabilization, while the second provider measures for and applies a cervical collar. The second provider then places a longboard behind the patient and between the patient and the first provider. The first provider can press the board against the patient's back with their body. The second provider can now grasp the board with their hand closest to the board in a handhold above the patient's shoulder. The second provider's other hand is placed against the patient's head with enough pressure to maintain inline stabilization, freeing one hand of the first provider. While maintaining pressure against the patient's head with their other hand, the first provider can now grasp the board in a handhold above the patient's shoulder. On command, both the patient and backboard are lowered to the ground. Once on the ground, the first provider can resume neutral inline stabilization, and the second provider can secure the patient to the backboard.